drugs and performance-enhancing drugs are very, very closely linked with sporting performance, especially at elite levels. We're going to have a look at 3 types of performance-enhancing drug today. We're going to have a look at anabolic steroids, which we'll cover first. We're going to also have a look at beta blockers, which we'll cover second. And we are going to have a look at, finally, at stimulants. Now, can I stress that these are by no means the only performance-enhancing drugs? Now, we are going to make an assumption that these are illegal in sport, which absolutely is the case for anabolic steroids. But bear in mind, there are some sports that do not ban beta blockers, and there are some stimulants that are not banned in sports, such as caffeine. Okay, so we'll just be aware of those facts. Now, let's go straight away to anabolic steroids. So what are they, first of all? Well, they are there, I've got the wrong blue, never mind, to up arrow, increase muscle mass. Well, that is what a steroid does. It is effectively a form of testosterone, the male hormone, which is produced both in the brain but also in the testicles, and if we take additional quantities of it, it can increase muscle mass, or particularly lean muscle tissue. It is very good for increasing strength, so start to be thinking about the types of athletes who might take performance enhancing drugs to, well, enhance performance. Why do they do it? Well, people do this because they can train harder, and I'm going to underline the word to train here, because that is, anabolic steroids are specifically a training drug, and it's really important that we consider that. And finally, performers can recover faster. So we often find that anabolic steroids are used for injury recovery. Now, our beta blockers have a whole different perspective to them. They are here to control heart rate. Okay, so heart rate, which of course can become very high in sporting and also sort of nervy type situations, can be controlled. It also controls, it helps to control calmness. Well, I should have really put it keeps you calm here. That would be a better way of putting it. It keeps you calm. It reduces, down arrow, anxiety. So beta blockers are there to prevent anxious experiences, and they block adrenaline. Now start to think about a type of performer that might benefit from this. Now, a couple of things about adrenaline. You probably know it's sort of overall general feeling when you get that adrenal release, but also adrenaline actually stimulates heart rate. So this is very much linked to this point as a whole. We could do a whole playlist on the effects of adrenaline on the heart at some point, but it's just as a very blunt point here. Adrenaline directly acts on the heart rate, specifically the pacemaker, and it increases heart rate. If we block that of course reduces heart rate. And what does this do altogether? It improves concentration. So the first thing I'm going to do here is name a couple of athletes that might use these 2 methods so far. We might be talking here about a weightlifter. We might be talking here about a sprinter. These are people that would be very inclined to move towards anabolic steroids. But with our beta blockers, you might be talking about someone like an archer, a darts player. We don't often talk about darts in PE courses, but it's useful in this case because they're trying to control those emotions, to try and stay calm. It's very much a fine skill. Now, what about these stimulants then? Quite a bit to do here. Stimulants arouse the brain. Okay, so we could be talking about amphetamines. We could be talking here about caffeine, for example. They do the opposite of our beta blockers. They increase heart rate. They also up arrow. They increase aggression. So start to think about the type of performer that might use these. Could we be talking about a boxer? Could we be talking about a games player? Maybe could we be talking about someone who has to react very fast, because this up arrow, it increases alertness. So this is going to be really useful for someone that has to react fast. We get a decrease in reaction time. Now remember, a decrease in reaction time means reactions are faster. Our reaction time is less long, I suppose. We get a decrease in pain. So people experience less pain if they're taking stimulants. But we might experience CV problems. By that we mean cardiovascular problems, heart racing. We might experience things like liver damage, which of course is really, really serious. And we might also experience things like addiction. Okay, addiction. Now that goes without saying all the things like injury. We might even experience something like insomnia, not being able to sleep. So obviously we're not arguing these stimulants are a good idea. Remember that different examples of stimulants, some of them are legal. Caffeine, although it used to be illegal above certain levels in sport, caffeine as a stimulant is now completely legal in sport, for example. Now, where we're going to go with this video next is we're going to keep it nice and simple. We're going to talk about performers. Effectively, why would and wouldn't a performer use a performance-enhancing drug? And everything that's kind of the advantages I'm going to put in green. So here's loads of reasons why they would. They basically have an up arrow better chance of winning. Performance enhancement is what it says. It makes you better performing. Therefore, you've got more chance of winning, more chance of improvement, more chance of making the first team, being faster, being stronger. They also, because of that winning, potentially, they might experience fame and recognition. If you taken our tutorials on my tutorials on things like sponsorship, the media, you might be sort of recognised and overlap. They might also have up arrow increased wealth. If somebody wins the 100-meter gold medal in the women's race, for example, they become world famous, right? But if they happen to have done that through cheating and PEDs, that might come crashing down on them as well. Other performers argue they are levelling the playing field. Levels the playing field. In other words, athletes do it because other athletes are doing it already and they need to be able to compete. Now, some of the downside for athletes, they will definitely suffer reputational damage if they are caught. So what do we mean by this? Well, they'll become known as a cheat. And that, of course, is very damaging to the individual. They could be sacked. If they're a professional footballer or a cricketer, say, they could be sacked from their role. They could be banned. Okay, now bans can be anything from months to years to lifetime bans. They could lose sponsorship. This happened very famously, of course, with the Lance Armstrong case. And if you don't know anything about Lance Armstrong, I know you guys are 15, 16 probably, you might think Lance Armstrong's historic story, but it's a stunning story of drugs cheating. I really encourage you to go and find out more. There might be health risks to the performer. We mentioned some of those with stimulants, but for example, very heavy use of steroids is believed to be sort of damaging to the heart. And we've mentioned already that addiction could be a negative side effect of taking a performance-enhancing drug. So that's what we're talking about there. Well, what about to the sport itself? What are the positives and the negatives, if any, of the sport to itself? So here's my green, all positive. We are going to say nothing. There is nothing positive for the sport about drug taking itself, but there are lots of negatives. We have got reputation damage, same point as before. If a runner becomes outed for drugs cheating, that damages the reputation. Cycling is a classic example of that. Very prevalent drug use in the past. The sport experiences suspicion. I remember Froome, Wiggins, Thomas winning the Tour de France, but being sort of tainted by the historical legacy of drug cheating. Interestingly, both Wiggins and Froome have had their issues with doping control, but that's a whole other story altogether. We might have, as we said already, the sport itself might have a loss of sponsorship. The income of the sport is lost because who wants to be associated with this dirty, unclean sport? We might experience fewer spectators because they don't respect the activity anymore. So it's like, why would I go and watch that if it's cheating based? It's not real. We get a decrease in participation levels. That's a down arrow, participation levels. The sport becomes less popular because it's so closely linked with drugs, for example. It's expensive, or if we put it this way, anti-doping is very expensive. Anti-doping is expensive. So to catch, to prevent, to have a testing system, to be linked to WADA, which is the World Anti-Doping Agency, is expensive. We also get a loss of trust that links to the lack of participation, the loss of sponsorship, amongst other things. We get historical issues. So, if we find out that in the past Lance Armstrong was cheating for 7 years to win the Tour de France, those titles have to be taken away. And how are they reallocated? You kind of can't, right? And this last one, honest athletes tarred. And that's really interesting. I mentioned I'll mention Geraint Thomas as the cyclist who maybe is the most clean amongst the ones I mentioned. That it could well be that his reputation is tarred because of the negative behaviours of others. That's performance enhancing drugs. Thanks.